بسم الله الرحمن الرحيم. Assalamu alaikum wa rahmatullahi wa barakatuh. Good evening. I'm delighted to welcome all of you today to one of the activities held at King Saud bin Abdulaziz University for Health Sciences under Women Empowerment Department, TEDUM, as part of our celebration of the International Women's Day 2022. As we talk about TEDUM, it's established under the Vice Presidency for Female Affairs. It aims to enhance the role of the women in community development, to continue to cultivate their leadership skills, and to support their decision-making positions. TEDUM has 6 programs, including research and innovation, volunteering, quality of life, training and development, family affairs, and enhancing leadership skills. It's a great opportunity, today, 8th of March, alongside our celebration of the International Women's Day 2022, to launch our new initiative, Saudi Women in Medicine, SWIM, under the Enhancing Leadership Skills Program. SWIM refers to all Saudi women who work in the medical fields, including medicine, pharmaceutical care, nursing, and allied health specializations. It aims to recognize Saudi women's achievements in various fields of medicine and to acknowledge their leadership and excellence. Dr. Wafa Sweri, the leader of the Enhancing Leadership Skill Program, will talk more about this initiative shortly. To end, I would like to thank our distinguished guest, Prof. Mahal Munif, and Dr. Fatin Al-Tahan, and to our moderator, Dr. Wafa Sweri, and to all of you for attending. We hope you will enjoy this webinar. Thank you.
So, assalamu alaikum wa rahmatullahi wa barakatuh. Can you hear me now?
Yes, we can.
Okay, thank you. I had some connection issue. Okay. Thank you very much, and it gives me a great honor to introduce for you our initiative of Saudi Women in Medicine with the 8th International Women's Day, which is the 8th of March. So Saudi Women in Medicine initiative has been done at the King Saud University for Health Sciences, being the unique university in the country and just only educating medical health sciences and allied health sciences. So it's an initiative to recognize Saudi women excellence and leadership achievements in medicine. And it addresses all women in medicine, not excluding other women in pharmaceutical care, nursing, and allied health care providers. So education in Saudi Arabia, since its establishment for women in 1960, has received a great deal of attention, and this has allowed Saudi women to make definite strides towards achieving their ambitions and unveiling their uniqueness in different fields. Since the establishment for the first College of Women in 1970, a special great attention was given to medicine field education in higher education. Since then, the government used education as a strategic goal for women's empowerment. And without being introduced to the word of empowerment, generations of women was heading toward it without realizing it. And like their male counterparts, Saudi women in medicine has emerged, not only at the local level, but also at the international level as well, providing their success and their worthiness similar to their peers in other advanced countries. The names I have posted definitely are not representative for all pioneering women in modern medicine. However, I just wanted to share with you some excellent examples that every one of us is aware of. So women are very integral in the 2030 vision. And they are also integral in every component of the 17 Sustainable Developmental Goals that has been adopted by the government from the United Nations, through which we have seen the golden era for Saudi women. A significant rise in women employment, women joining the Shura Council, women joining and being part of the Saudi Human Rights Council recently, and a recent publication of laws addressing gender discrimination salary, especially in the private employment. I cannot get this occasion pass without telling you about our recent celebration in the university for the success of the first health hackathon that has been shared by the Deanship of Student Affairs in collaboration with two major institutes, which is the Munshaat and Sadaya. And it has included 22 universities, and all were undergrad students. They shared their innovations. And guess what? At the end of these 5 days, the winner for the first seats were young female students from two governmental universities. So, between living these aspirations of endless possibilities and opportunities and the reality of the current women's progress, the idea of having documenting Saudi women in medicine came along. We are looking for it to be the leading force in fostering excellence, leadership, and pioneering of Saudi women in medicine, to achieve a national and international recognition of Saudi women excellence achievement in various medical fields, with our values being excellence, novelty, respect, commitment, accountability, partnership, and collaboration. Our objectives is to create a national network to inspire, connect, cultivate, and celebrate women's achievements. We have a lot to share with each other. And also, every one of us knows the role of modeling and mentoring and coaching. And this is now the right for young generations, especially in the fields of research, clinical activities, leadership, and volunteering. We are looking for this network to help advancing leadership skills for women, especially using education and research, and to ally with our male counterparts, health leaders in healthcare, community services, and volunteering programs. There is a good data that shows that women in academic medicine advances and women's healthcare leadership in healthcare leadership positions is associated with improvement in health, women's health as well. So we are looking to be an advocate for women's health and professional consent. And one of our delegate speaker tonight is one of the leaders in this field. We are looking to establish a national registry data for Saudi women in medicine in every specialty and subspecialty to support them in reaching their career goals and to improve ultimately their recognition by international publishers of global women's indicators. Using the digital information systems, we are looking for an online showcases for those leaders and pioneers, highlighting their national and international contribution in research medicine and community services. So who will benefit? All women in various fields of medicine and science, definitely decision makers and vision realization offices of the for Vision 2030, governmental and non-governmental institutions dealing with national development and strategic planning, national and international entities dealing with women empowerment, as well as the academic sector represented by national and international universities. What is the landscape for this project? First of all, the governments, we are having a governing board or a consortium, which is going to be represented by almost all women in academic and non-academic institutions and hospitals. The implementation this is the first step of it by launching the project. We are looking also and working on having a digital website through which we can have proper communication. We are targeting to have a database, and we need the help of everyone to fill in and to build up this database. The sustainability is a challenge for any young projects. However, we are going to have an alliance with male healthcare leaders and national public organizations. We are looking to have a swim business office in each university and create supportive links for volunteering programs with NGOs and private sector. We are going to have a rich environment for research publications, and eventually we are looking to have also an annual meeting whereby we meet with each other and exchange the experience with each other. So by the end of this slide, I hope I have accomplished my mission of launching this initiative. So we would like each one of you to be part of the swim and to inspire and the change and celebrate the progress. And this is the link for registration, as well as the email and phone for further communication. By the end of my presentation, I would like to move to the next part. So I'm going to introduce our next delegate, who's a dear friend of mine, Prof. Maha Al-Munif. Prof. Maha Al-Munif is a graduate from Yale University with a postdoctoral degree in pediatric infectious diseases. Being a pediatrician passionate about advocating for women's and child rights, she is a pioneer in the field of child maltreatment and domestic violence in Saudi Arabia. Her dedicated, passionate work ended up with the foundation and establishment of the National Family Safety Program to combat domestic violence through awareness, advocacy, capacity building, and service provision for victims of abuse. She is the recipient of International Women of Courage Award in 2016 and a recipient of Prince Naif Woman of Excellence Award in the category of National Security in 2017. She served as a temporary advisor to the WHO and elected as a counselor in the International Society for Prevention of Child Abuse and Neglect. Moreover, Prof. Al-Munif is a professor in pediatrics at King Saud bin Abdulaziz University for Health Sciences and the head of a child care department at King Abdullah Specialized Children's Hospital in Riyadh, Saudi Arabia. So most welcome, Prof. Maha, and the floor is yours.
Thank you, Dr. Wafa, for the introduction, and congratulations to you personally and to the University, King Saud University for Health Sciences, for launching such a great program, Saudi Women in Medicine, which is really needed so we can all ally together as women. And what a wonderful day to launch such an alliance in the International Women's Day. So on this day, I would really like to congratulate all women on their achievement in Saudi Arabia. I was asked to speak about a subject that is dear and close to my heart, and there is nothing really more close to me than child protection in Saudi Arabia. And I would really like to take the next 20 minutes to give you an overview of what happened in the last 20 years in this field. This is when I was involved in it. And then we try to answer a couple of questions that is important in this field. So if you look into child protection, I divided in the last 20 years into 4 stages. The first stage, which is from, it is all in the new millennium, from the year 2000 till 2005. And in this stage, we recognize child abuse as a public health problem. It became really evident to everybody, to the lay people, that we have problems and we do not have really good services or law to protect children. You may ask, before that, what did we do? Definitely there was some work done, and the most important one is in 1996, Saudi Arabia has signed and ratified the Child Rights Convention from the United States, from the United Nations. However, child maltreatment was really locked in books, in the literatures, among professionals, but was not really in the public eye. And I think the difference that happens in this time, it became in the public eye. Everybody was talking about child abuse as a problem, and we really need services. Short after that, a lot of organizations started establishing from 2005 till 2010. For instance, we established National Family Safety Program in 2005, and in 2004, the Ministry of Social Affairs established the Protection Department, Human Rights Commission, Human Rights Society, and also non-governmental societies that were specialized in child protection. So this year there was a lot of movement by the government and non-government organization to try to address the problem in scientific and more strategic way. Of course, after you establish this organization, a product has come. And the best product, I would call it, from 2010 till 2015 was really the legislations, enactment of different laws. And the most important is child protection law that was enacted in 2014, and protection from abuse law enacted in 2013. Also at that period, there was a lot of national studies, so we start knowing how big is the problem, what are the risk factors, what we should really do, and services start to be established, from reporting to rehabilitation. And we had a few hotlines, like the hotline 1919 for abuse, and the child helpline 116111. So by 2015, we developed a lot of services to diagnose, treat, rehabilitate children, and to protect them from violence and abuse. And I think the last stage, it's not the last, but at least from 2015 till 2020, I think this is, I mark it as a Vision 2030 stage. This is the time where the government, the higher official in the government, start looking into the subject seriously and addressing it. We had the Family Affairs Council that they have committees regarding for children, and it addresses child protection. Also, we start having better and more specific laws, like the sexual harassment law, social status law, and other law. And we start looking into more advanced services for the protector. So this is really an overview. And I think from 2020 till 2025, I think we will see a period of implementation of the law, and we will focus on prevention more than just protection. Saying that, that will take me to the second slide. It seems that I cannot control it. Can the organizer control it? I don't know why I'm not controlling it. Okay. So, so I tried to, in the next 20 minutes, to answer a couple of questions. The first of questions, when we talk about child maltreatment and child protection, the first questions come to mind is, how big is the problem in Saudi Arabia? Is it really worth that somebody like me who's specialized in infectious disease and then as a pediatrician to go really after this problem? And then the second question is, if it is really a problem, is it really, how bad it is? Is it really having a long-term consequences on us as a government, as a nation, and as an adult? And also, the last question I'm trying to answer is where we are heading after that, after the milestones that I took you through. So how big is the problems? In order for us, we as physicians, to know how big is the problem, the first thing we ask is what is the incidence and what is the prevalence of any problem, so we can make a decision, is it really a big problems or not? So when we talk about incidence of child abuse, we talk about reporting cases. And who report child abuse? The mandated reporter in our country is healthcare sector, social department, and the legal department. So all these three departments, they collect data from the cases that comes to them with child abuse. So in the health sector, I was honored to establish the National Family Safety Registry. This is a web-based registry that take data from more than 120 child protection centers from all over the country, from the 13 provinces, from all children's hospital and general hospital who are taking care of children. Each hospital, they have a center, they manage the cases and they put their data in this registry. So we will be able to know how many cases of reported child abuse in the whole nation. Social services also collect data from their hotline 1919. Any case who called for child abuse in this line is recorded. And also the legal department recording the number of prosecuted cases. And in my opinion, this is really the tip of the iceberg of what is happening. A lot of cases do not really make it to the prosecution department. So the registry, we started the registry in 2013, and from 2013 until now, the cases has been increasing because the centers increasing and the recognition of child abuse and diagnosis of child abuse in the health sector is increasing. So for instance, in 2019, we recorded 1,210 cases of child abuse in the country, and we could really see the pattern of abuse. So you can see that physical abuse is more common and followed by neglect. So you can, as you can see, since we started in 2011, the cases has increased. And you may ask yourself, does that mean child abuse increasing in the country, or the recognition is increasing, the reporting is increasing? It is very difficult to answer these questions, but I do believe that the recognition and the reporting is increasing, especially with establishment of child protection centers in every hospital that deals with children in the country. The social services incidents also, they report much more cases than health sector because they receive milder cases. So they on average, they record more than 4,000 cases of child abuse per year. And physical abuse and emotional abuse represent almost 75% of the cases. So if you look at the incidence and if you calculate it, we have about 10 million children less than 14 years of age. So you can get an incidence of 20 per 100,000. If you look at this incidence, you may say that this is not really a big problem. We have other health issues that children suffer from that is more common. But you know, the incidents really depend on reporting, and we know child abuse has a lot of obstacle on reporting. So that's why we had really to rely on prevalence. So let's look at the prevalence of child abuse. And prevalence of child abuse, the best way to know how big is the problem from prevalence is to do researches and ask people, ask kids how many times they are abused, what type of abuse they are exposed to. And we did a study called ICAS, which is International Child Abuse Screening Tool. This is a tool that was done by UNICEF, and it has been used by different countries. And the importance of this tool is we can compare our data to any other country in the world. In this study, we sampled almost over 19,000 school children from the age of 12 to 18. Attending intermediate and high school in all regions of the country. And we asked them about if they have been exposed to violence. And you can see that emotional abuse was really high. About 81%, they said that they have been exposed to verbal abuse, followed by physical abuse, 64%. Remember, this is ranging from mild to severe form of abuse. Healthcare sector tend to see more of severe cases of abuse that really require health services. Sexual abuse was about 13.5%, and witnessing violence is 58.5%. So you can see from prevalence that about 50%, that means 50 per 100 of children are subjected to some sort of some type of abuse, ranging from emotional to physical to sexual. And comparing that to the incidence, you can come with a conclusion that a lot of cases of child abuse, and namely the mild cases or the moderate cases, are not really reaching services, are not really reported, and we don't see them in the health sector or in the social sector. The second question I'm trying to answer now is, after knowing that the problems probably is really big, and we are not an exception in any part of the world. Child abuse has been known for many years, and it's all countries. It's a pandemic that all countries are affected by. And the difference between country and country is how much services you provide and how much prevention program you do to prevent child abuse. So the second question is, if this is a problem and it affects many children, what is the outcome of it? And especially for adults, I mean, these children, they become an adult soon. So what is the outcome of these problems on adult health? And the best study is adverse childhood experiences. This is a study that has also a questionnaire done by WHO, and this is a study done by many countries, and we adopted the questionnaire, and we did it in 2012 in the country, and we interviewed over 10,000 adults in all regions and all cities in Saudi Arabia, and we asked them about their childhood. Have you been exposed to violence, sexual violence, physical? And there was a specific question that indicate physical, emotional neglect, or sexual abuse. And at the same time, we asked them about their health now and their risky behavior. And we tried to link, if you are exposed to violence, does that affect your health as an adult? And these are the questions we asked. So you can see that living in a household that has domestic violence was 57%, was the highest adverse childhood experience that children are exposed to, followed by emotional abuse. Physical abuse was 40%, neglect 29%, sexual abuse was almost 21%, and violence against mother was noted to be like really one of really things that affect children, even if the perpetrator did not hit children, but it's hitting their mother, is about 24%. So these are the 13 ACEs, I call it, that we ask people about. And any person who report this, for instance, if somebody report that they are emotionally abused and physically abused, they take a score of 2. And you can see that only 20% of the population, they said they did not have any ACEs, and almost 80% they have at least one ACE. So if you can't, what we did is we compare the last 2 bars, the 4 ACEs and the more, which is about 30%, to the first 40%, which is the one who had 0 and 1 ACEs. And we want to see if there is a difference in their outcome as an adult in terms of health. And you can see in terms of chronic disease, the susceptibility to chronic disease in patient in children who had, or in adults who had bad experiences in childhood or had been abused as children, and they had 4 or 5 ACEs, the diabetes increased from 12% to 26%. Hypertension increased from 16% in people who had 1 or 2 ACEs into hypertension 29% in people who had 4 to 5 ACEs, chronic heart disease from 4% to 10%, and even obesity from 3% to 8%. So you can see that the risk of chronic diseases in adults who are exposed to bad experiences in childhood is about doubled. When we looked into mental health illnesses, actually it's tripled. So you can see depression and anxiety moved from 6 and 9% to 25 and almost 30%. So the risk of having mental illnesses, if you live a bad experiences in childhood, is really high. And then we went through into looking, do they go into risky behavior, go into alcoholism, drug addiction, and you can see that it went up almost 6 times. So we know that exposure to bad experiences in childhood put these graduating adults into risk for chronic diseases, chronic physical diseases, mental diseases, and risky behavior. And when we compare male and female, there was a big difference. Adult male tend to cope with these stresses and when they were children with adopting risky behavior like drinking alcohol or using a drug, while female tend to internalize their symptoms and they present their these stresses during childhood as an adult into mental illnesses. But you can see that there was no differences in physical diseases. So we concluded from this study that really our childhood determine our destiny. And now the adult medicine physicians, they are really looking into, when they are dealing with any chronic disease in adult, they are asking about childhood, what kind of childhood this person is getting. So really our childhood determine what we are as an adult. And also, and this is why it also affects the economy of the nation, because, if you are living a beautiful childhood in terms of the economic, becoming a productive adult and improving the economy of the country indirectly. So the third question and the last question is where we're heading, what we should really do now. So we know that we had child abuse. We are not really an exception to any part of the world. We know that the long-term consequences of child abuse is really high and it affecting the adult. And what we should really do. We should really continue doing what we did in the last 20 years, initiating services, improving the law, implementing the law, etc. But I think we should really work harder on changing the social norms. What do I mean social norms? Before, every time I say that change the social norm, I said it is very difficult to change it. However, witnessing what happened in Saudi Arabia in the last 6 years of changing social norms, I can say now with confidence that we are a very resilient society, that we can change our social norm that are negative and that can affect children. And one of these social norms is the belief of corporal punishment. I always say that there is a fine line between corporal punishment and abuse. Corporal punishment per se is a mild form of abuse, but a lot of people believe in it, believe that it really helps and it works. So I think one of the initiatives that I'm working on is to changing the social norms, is that we really need to tell people that corporal punishment is harmful, it doesn't work, it doesn't help children, it causes behavioral problems, and it can progress to violence and abuse very, very easily. And then we have really to get positive parenting program going on. And I think I will end with this slide. What we did in King Abdullah Specialized Children Hospital is we initiated a program called No Hit Zone in the hospital. And we say that we are abandoning anybody to hit children, no matter what. And we say no child hit child, no adult hit child, no adult hit adult. So we are against any hitting. And this is, maybe it is not violence, but it is even a simple hitting, because it can progress to be an abnormal behavior. Saudi Arabia forbid hitting in schools, but there is no law to forbid hitting at home. Now, 70 countries out of 192 countries who signed and ratified Child Rights Convention, they have a law that prohibit hitting at home. And I hope in the future, Saudi Arabia will adopt that law, and we will be hitting children at home, will be really against the law. With this, I would end my talk, and thank you again, Dr. Wafa Sweri, for the invitation, and I hope you enjoyed this quick overview of child protection.
Thank you very much, Prof. Maha. Sure, we did. And this is an extraordinary summation for almost 15 years plus experience in the field. And it's an excellent reflection and a review of the topic. So great talk. Thank you very much. And we appreciate your contribution.
Thank you.
So our next delegate speaker is also another dear friend of mine. Her name is Dr. Fatina Tahan. Okay. Dr. Fatina, you are with us?
Yes. You just permission to share?
Yeah. So you can share your presentation.
From where I can share my presentation.
From the share icon, the one with the arrow up. So I will introduce you first before you go ahead. So Dr. Fatina Tahan is a senior radiologist at imaging and cancer screening and women health consultant. For almost 7 years, she has been the director of cancer control program at the Ministry of Health and currently working as an expert consultant for cancer screening program at the MOH. She's been at the director of Women Health Program between 2008 and 21, which is considered dedicated program that is covering all aspects related to women health based on life cycle, focusing on implementing policies related to early detection of diseases and collaboratively integrates them into relevant programs and enhancing women empowerment to care for their health. So her devotion to champion programs for the prevention and early detection of breast cancer was an essential principle in her personal and professional life. And she re-owned the reputation as the champion of women's health awareness in Saudi Arabia. So welcome, Dr. Fatina, and we are happy to have you as our guest speaker tonight, and the floor is yours. Unmute yourself, please.
Thank you for inviting me, Dr. Awafa, and I'm so honored that I'll be part of the SWIM initiative. This is really a great opportunity that all our new generation to know that there is a woman who start to fight for their right in a place where country was men oriented more. However, we have very great and nice life and history. I'm so happy to be part. I will be part of the pioneer ladies in medicine, and it's very nice that we are really in. Implement our launching this swim and great day for International Women Day. I will talk about Women Health Initiative among Saudi ladies, and this is part of the Vision 2030. I think our ladies, they deserve that we have to initiate the program, not only initiative to take care of their health. And let me say that why it's so important to do to implement the Women Health Program, because for many years, decade actually, there was a historical link between the concept that only women health is focusing in reproductive health only, and of course what's related to a child health, and neglecting other aspects of women health. Although we have a lot of benefit and good result for focusing on this reproductive health, but I think women health is not limited to this. It's quite more wider and extend through all her woman life from cradle to grave. And indeed, however, this focus was a big barrier to expand and improve the other health aspect service for women health. And this was documented from the even WHO, it's globally. How it's important to realize that women health is not only relevant to women themselves, it's the cornerstone of family and the society. So it's have a big impact on health and development for the next even generation. So it's very mandate now to accelerate the momentum and protect the gain made for women health, as well as to tackle critical gaps. We have very gaps and acknowledge all lessons we learned during all these years. Let me just start with some facts why it's women health is very important. Our population is 33.4 million, 20.7 million are Saudi. Almost half of them are female. So we are a big part of the population. Society almost have 49%. However, we are still a new nation, or we have big number. More than 67% are people with are younger than 35. And 33% are above 35%. The above 50%, 50 years old is only 14%. This is why if we start to work from now, I think all the new coming generation will benefit from this. 67% of our ladies, they got married, and 5% of them divorced or separated, 70% widows, and only 22% are unmarried. Maybe now with this was statistics for 2018, last one we have it, but I'm sure now it's more than 22% with the engagement of women, especially in labor force. Average age of marriage is 21, and polygamy, it's one of the aspects we also search for it, and 90% only with people who are not educated. Most of them was during ladies who are really well educated and or having been have some kind of education. I think most of our female they got for primary school, but over 35% only they attend secondary school. 37% attend the university. In 2019. And now if we have, I'm sure 2022 and 21, we will have more than 58% of our female share of the total labor force. I'm sure it's now much more. We are waiting for the last الإحصاء statistics النهائي إن شاء الله at the end of this year. The wage of the Saudi worker is 10,000. However, we don't have really good data for this, for difference between male and female. Now for the health part, for the risk factor, it's amazing that almost 76% they never have routine checkup, medical checkup. This is quite depressing and tragedy. 93% of our ladies, they have unhealthy diet intake and 80% poor physical activity, and this is really big risk factor. 33% of our ladies are overweight, 21% are obese. We have high, or 43% high cholesterol. By the way, it's all more than, I did not put a difference between male and female, but we are higher from the male side. Anemia is quite common in our as a problem with in our lady health, women health. I don't know if this is real, reflecting the smoker in 4.2%, but all of us, we know that smoking now it's like a trend, especially the shisha. So, but unfortunate with our statistics, I don't think a lot of ladies, they pronounce that they are a smoker. And this was evident by lung cancer is increased in female last 5 years. Diabetic is also more, almost like the male, 4.3% and increase with age, and 12% are have hypertensive. However, more than half of the cases of new cases of cancer is among ladies, not male, and the average age is around mid-50. And of course, breast cancer accounts for number one third of the cancer case in ladies for breast cancer, and then followed by thyroid and colorectal. Asthma, it's up to 25%. Now, for the mental health issues, we have quite 8.9%, which is almost more also than the male side. They have a depression, not the regular depression, bipolar 2.2%, and anxiety is around 11.7%. And they, unfortunately, these more common in the high school girls. And this is, we have to look carefully for that. And 64% of women above 60, and they also have reported injury and faith. Now, I think I will not talk more about violence. Dr. Maha, she already talked about it, but we, as she said, maybe her statistics is more, more deep, but this is what was published from the National Family Safety Program report in the last report, 2018, the incidence of violence again among especially the young girls between 13 to 18. Neglect was one of big one. Per relationship violence, 44%. Bullying is almost 40%, and this is we face it with. I think most of our daughters, they have an incidence of this, and inappropriate relation. It's fortunately it's not quite high. For the we have, as I said before, we have good results with the with the antenatal care, 93%, and for the sexual health, unfortunately, we don't have good published, but everybody of us knows that we have a problem during puberty and perimenopausal, postmenopausal. We have real sexual health issues where this is what the gap we have. We want to tackle it. MOH is the major governmental health agency to provide the service. However, the seeking access, access of the service is quite difficult, except for primary care centers, which does not have good trust among the community. We have a lot of beliefs and social, which is misconceptions. This is, we have to tackle it. We have also now, last 3-4 years, we have good more volunteers and participation from community there. Now this is also an issue. We are working on it to increase the activity and participation of women among the community. However, what's bad with the social media now, social media, unfortunately, commercial companies, lobbies and advertisement affecting a lot of lifestyle of women, and this is also another issue. We have to talk about it widely and transparently. You can see that even not only the young generation, even the older women, they are really affecting their lifestyles with this all commercial business. We still have some taboos to talk about, especially which is for sexual issues and also for some kind of cancer. This is why we have until now advanced presentation of cancer, because the ladies, they are afraid to present early, although they feel that there is something bad in their body, especially with the breast. And we also have some finance problem to go for the preventive checkup. I think a lot of houses now depend on the salary or the income of the ladies. I was so happy yesterday to know that we have a policy now cover all the periodic checkup. This is a good step. And good, now we have a lot of our ladies, they are in the IT technology, informative technology. And we have the bad scenario and we have also good scenario on the women life. So this is why we think now it's an urgent need to change. We need what we call it blue out of change needed in order to save lives and also to improve the quality of the woman life. Very important. And it's very important that the agent of this change, it should be the lady themselves, women themselves. This is why it's very important to empower the lady taking the decision in improving her health, not waiting for her husband or father or even to set her priority in life. Still until now, unfortunately, most of our ladies, they don't put that the health is very important priority in their life, because I think only the health nowadays can break your system, can break you really. So this is why very important that to take care of your health as a woman. Women Health Initiative, as we said, we want to empower the lady and enable the Saudi lady to achieve healthier, safer life, and with full dignity and also equal with contribution and development in environment free of any violence and discrimination. So our mission to promote health and social status of Saudi women through developing and implementing quality intersectorial. We have to have policies as well as the program. Policy is very important, highlighting also gender concern, very important, and we have to have law and legal and support from the policy maker to do regulation and even to force. Sometimes I am looking to force the lady to take care of her health and do the periodic check. And very important that the women, they should realize that their right to, as well as they have right, as well as they have responsibility to take care of their health. Need a lot of awareness. And the principle, equity in the between female and male, and also equity between the group of women, like working women, also women with a special need. We also principle, we have to have taking care, we have to implement a service where our whole life course approach lady from at least puberty until the end. And very important to focus on prevention, because let me tell you, 73% of our health problem is a chronic disease, including the cancer, and this is account for the second cause of mortality among our society for premature mortality. Which so a chronic disease is or we call it NCD, is a big concept in our health problem. This is why we should focus on prevention, and of course we should initiate and support all the resources to have a good research and also good data. We need high quality data. We are missing this high quality data. So the goal of our initiative or program to improve the status of the lady, and of course to reduce morbidity and mortality rate among women by providing an accessible, affordable also, and equitable, responsible, quality healthcare service. And also in order, also we should have laws and regulation to protect women's rights and enhance her fully support and participation among the community and among herself also. And also we have to, as I said, knowledge and awareness is very important that we should do a lot of awareness to first acknowledge and aware the lady herself about her right and also her responsibility. This is the key dimension, how we focus during adolescent and adult women health, and then older above 60 and 65 years. I mentioned that equity between the different pattern of ladies. Working women health is now, especially with the involvement of the women in labor force, working women have a special kind of health problem. It's not only physically but also emotionally, where there is a lot of challenges between ladies, women and men, and between also working women themselves. It really affects her lifestyles. We see more obesity now, and anxiety, depression, more frustration and fear of losing job, of also taking her right on the job. And this is also, this is kind of health issues. We find it more with the working woman, and this also affects also her family and her children as a working mother. So this all issues been put in addressed, that to be also put in the agenda of the initiative. Action plan will be based on this. As I said, political commitment and leadership is a must and will play a great role to improve and even to implement the program and the all initiative for women health. And thanks God, I think we have a lot of support from the leader these last 4 years. I mentioned gender equity and equality approach with the health system. We have to assure that. I mentioned the human rights, and I mentioned the integrated and collaborative service for all health issues. Unfortunately, till now, we have, yes, we have a service, but until now, it's still fragmented. We want to put it in one group to be a comprehensive approach. And of course, to meet the universal health coverage, it's a must. And I think the Kingdom of Saudi Arabia was also signed for this in the United Nations. We need women to be more engaged about her health and her also other women health. And we are looking for policy to be even mandate. And this is very crucial issue. And of course, we are looking for partnership and intersectoral collaboration. This is mandate and a must to get a result. And of course, the plan will be, the implementation will take phases. So how we start? We start, of course, we set this policy and strategy, and then we read what we call it well women screening clinic and shopping mall. This is one really novel step in the health sector for the kingdom. I don't think there is any other country in the globe where they have one woman screening clinic in shopping malls. And this was the nice or the beauty of this program was done during PPP, or what we call it public-private partnership, where a lot of businessmen and they have donate for these for the place, for the also equipment, for everything in this clinic, and this run by the MOH It's really comprehensive and holistic approach to tackle all the chronic disease, which I said it's responsible for early mortality before 70 years. And we do screening for all NCD and early detection for cancers. It's very affordable, it's cost-effective methodology that it's very, it's accessible where lady come to shopping mall, she relax, come to the clinic, and enjoy the company with her other relative or her family or her friends, and just do the full checkup. This checkup, by the way, in private, it costs like 10,000 riyal, and it maybe need 5-6 visits. And in the governmental hospital, it maybe take you more than 1 year to finish all your checkup. This is within 45 minutes, less than 1 hour. You do all these service in a clinic where furnished, decorated. This is, picture of the clinic. We have it in the shopping mall. We do also training. We do also health education. We have the mental health also, where this run by also psychologist Thea. As I said, we do education for all, health education for all important health problem in women. The service we provide there, we do screening for, in addition to the health education, cardiovascular screening, diabetic, obesity, overweight. We do for the osteoporosis, osteopenia. We do also screening for cancer, early detection for breast, colorectal, and we are preparing for cervical cancer screening. We do also mental health checkup, and also recently we also having smoking cessation service where because we noticed that the smoking become a pattern among our ladies. The strength point of this, as I said, it's easy access, and we do comprehensive service within less than 1 minute. It's free of charge, very cost effectiveness, and it solves most of women obstacles. Why we have well-trained female staff, and we open afternoon 7 days per clinic per 7 على 7. We have only holiday during Eid only. It's open the whole year with the relaxation area. So as I said, service provides a skilled team, good communication, and very important, we have also continuity of care. If we have any problem with lady, we think she needs tertiary center or secondary center, we refer her ourselves. We have what we call it fast track service. It's very nice, excellent PPP example for participation with the private sector. And also we have an excellent patient or women satisfactions. And this is according to, we did the public feedback. We open until now 20 minutes. We are aiming to have 50 minutes in all over the kingdom, and maybe more 100. And the fact it's until now, since 2014 until now, it's still running. This is give you a good, most of the المبادرات أو initiative usually within 1 year it's actually no, it's expanding. And this is why it's very important. We got lesson from this successful story, that very important that we engage the society, including the business people, and we tell them this is an investment, long-term investment, and we brought all the expertise with our team. We took also the feedback for all stakeholders, including the women themselves, and we also set the goals and the future plan with all stakeholders and partners or our partners. At the end of my talk, just to take this home, let us, it's an urgent, it's a priority to implement women health and to expand in women health. Let's make it let's look at it as it's a real investment for our community, because healthier women, that means healthier children, healthier family, healthier communities, and this will benefit for our next generation. Current and next generation, as we said, we are young generation country. where I said more than 60% is below 35 years of age. And very important to empower the woman that she should be the agent on all these changes we are looking for, that we will take care of her health. She has to know that health is a priority in her agenda. And thank you for listening to me. I hope it's a clear initiative for all the attendants. Thank you.
Thank you, Doctora. That's a great enlightening everyone, including myself, about the Women Health Program in the country. It's a wonderful initiative that we are wishing that it will continue and expand in all what they call it countries, in all parts of the country. So thank you very much for leading the program and being part of it. I hope that the attendee also, our guests, they have enjoyed the talk. I'm trying to confirm that presentations are recorded and they will be available on the website. So anyone who wants to share it can go back and share it. So by the end of the talk of Dr. Fatina, I believe we are coming to the end of this webinar. So kindly be also be part of this SWIM initiative to inspire the change and celebrate the progress. And I wish you happy Women's Day. My best regards for all. Lima, if you can switch on the video kindly.